Mesh surgery in urogynecology have been filled with a lot of misconceptions and misunderstandings. So in today's video, I'm going to clarify what is a myth and what is a fact regarding mesh surgery. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. Welcome back to the channel. Here we talk about everything pelvic health. So if you like what you see, don't forget to subscribe and share it with a friend. I recently hosted a patient education webinar where I talked about overactive bladder or urinary incontinence related to urgency, frequency, not being able to make it to the bathroom, as well as nighttime urination, as well as fecal incontinence, which is where patients feel that they have no control of their stool and having accidents when they have the urge to go. Now, if you missed the webinar, don't worry because I have a recording of the video just for you. If you want to get access to it, then click the link in the description below and the webinar will be in your inbox in no time. And I know you're going to get so much out of it and find so much value. And now back to the episode. So let's talk about a few myths versus facts regarding mesh. Myth number one, mesh is always dangerous and should be avoided at any cost. Not true. Something that I tell my patients is that mesh is not the problem. General surgery have been using mesh for hernia repairs for years before we started using it in urogynecology. What I do tell patients is that mesh surgery for the right indications with the right patient, with the right surgeon, with the adequate and specialized training can be a great option. Again, it's not one size fits all, and of course mesh surgery is not for everybody, but if you're somebody who's suffering with pelvic organ prolapse or suffering with stress urinary incontinence where you're leaking urine with laughing, coughing, sneezing, make sure you go to your urogynecologist who has a lot of experience with mesh surgeries and can talk to you about some of the benefits and can evaluate you and let you know whether or not you'll be a good candidate for it. Myth number two, all meshes are the same. That's not true either. We use mesh for different indications. There's mesh that we use for sling surgery, which is to help women with leakage of urine with laughing, coughing, sneezing. So this is an example of a mesh that we use for sling surgery. As you can see that the width of the mesh is much narrower, and actually the single incision slings that I do more commonly now for my patients, the actual amount of mesh that goes into the body is very minimal. Then we use something called a sacrocolpopexy mesh, which is for patients who are suffering with pelvic organ prolapse. Now this kind of mesh is often known as Y mesh because the mesh itself looks like the alphabet Y. And these meshes, as you can see, it's much wider. It's the same material though, which is polypropylene, but this mesh we put inside the patient's abdomen, and usually a lot of the times we'll perform a hysterectomy at the same time. And with the mesh, we attach one arm of the mesh on top of the vagina, the other arm on the back, and then using the tail, we pull the vaginal wall so that it can be suspended. Now, there's also something called transvaginal mesh to help patients with pelvic organ prolapse, where we used to use a larger piece of mesh vaginally to help suspend the pelvic organs. However, a lot of the controversies that happened with mesh complications were in the patient populations that were getting transvaginal mesh. So as a result, the usage of transvaginal mesh has been minimized significantly. So all the companies who were initially producing these transvaginal meshes have been banned from doing so. Majority of the urogynecologists in today's times don't necessarily use transvaginal mesh. Now again, just to clarify, it's not banned, but like I said, some of the mesh kits that were available to perform these transvaginal meshes are not available in the United States anymore. If there is a patient that needs transvaginal mesh, that's an individualized discussion to have with your urogynecologist and then weigh in the pros and cons appropriately. Myth number three, mesh surgery is banned worldwide. And that's not true. There are countries in the world, such as the UK or Australia, where mesh usage is much more limited than, say, in the United States. I already kind of discussed the history of why we had some of the controversies with mesh. Having said that, mesh usage for sling surgeries, mesh usage for abdominal prolapse repairs for sacrocolpopexy is not banned. We used to use transvaginal meshes a lot more commonly. We don't do that anymore, primarily because the companies who used to produce these transvaginal meshes are not producing these kits anymore. But having said that, mesh use in the United States is not banned at this time. And in fact, if you're curious, the most recent patient safety guidelines by the FDA is available online. If you Google mesh-related complications FDA, you should be able to find it. The most up-to-date patient safety guidelines came out in April 2019, and it clearly states over there that mesh usage for sling surgery, for abdominal prolapse surgery is safe because the benefits significantly outweighs the risks. Myth number 4. Mesh surgery is the only option for patients who are suffering with incontinence and prolapse. Not true. Yes, we do use mesh for patients who want a sling surgery for incontinence. It is one of the most common surgeries for patients who want more long-term success rates. Similarly, for patients who have advanced stage prolapse, mesh surgeries do provide the most long-term outcomes. But having said that, if you're somebody who doesn't want mesh surgery, there are lots of other treatment options, including surgical as well as non-surgical. And I have tons of videos in this channel that talks about the various different treatment options, so definitely check it out. And finally, myth number 5, mesh complications are inevitable and the only way to solve it is by removing all the mesh from the body. Again, not true. Mesh complications are rare in today's day and age if you go see the right specialist. So if you're somebody who's suffering with pelvic organ prolapse or suffering with urinary incontinence, and you've tried some of the conservative measures or tried some of the non-mesh surgical options and you want to consider mesh surgery, please make sure you do your research. Find the right physician, the right specialist with the appropriate amount of training and truthfully appropriate amount of experience doing these mesh surgeries. Again, I'm a board certified urogynecologist and a pelvic reconstructive surgeon. What that means is I went through 3 years of additional training to be performing these surgeries safely. So you cannot just go to anybody and expect that they're going to perform these surgeries for you. A lot of the times I have seen patients who come to me because they've had mesh surgeries done many, many years ago, and now they're noticing some of the complications. Most commonly, the mesh coming out through the vagina, or the mesh going into the bladder or some other pelvic organs. Usually in those cases, I'll talk to patients about removing the portion of the mesh that's coming out. It doesn't mean that we have to remove the whole mesh that's inside the body, especially if that mesh has been placed many, many years ago, because there's probably going to be a lot of scarring. It's probably embedded with some of the tissue. And trying to dig up some of that old mesh may actually cause some more trauma to the patients that's not necessary. Hope this video was helpful to help clarify some of the misconceptions and some of the facts versus myths regarding mesh. This is one of the most common concerns that I hear from my patients when they come to see me in the office, because I do want patients to be aware of all the different treatment options, and inevitably mesh surgery comes up and they're petrified because they've heard all sorts of news, they've heard about lawsuits. And my goal with this video is to help clarify some of that misinformation so that next time you go see your specialist and ask them about some of the surgical options for yourself, you know what are some of the concerns and some of the questions you can ask to get the best treatment for yourself. If you haven't already, don't forget to subscribe to the channel, and I'll be back next week with another exciting topic regarding your pelvic health. See you soon. Bye.